Hey guys, this is Dr. Hub. Let's look at the mechanism of action of hormones. So to begin with, the type of hormone receptors. First is the hormones and that bind to the intracellular receptors. So what is included here? So here there is a cytoplasmic receptors. So under the cytoplasmic receptors, what are present? It includes the glucocorticoids. There is glucocorticoids as well as a mineralocorticoids. Then there is also presence of the androgens. Next we look at the nuclear receptors. So under the nuclear receptors, it includes the thyroid hormones as well as the vitamin A and D. Now let's look at the hormones. Hormones that bind to the cell surface receptors. So the hormones that bind to the cell surface receptors. So we look at the GPCR. GPCR stands for the G protein coupled receptors. So this includes the GS. So GS means the stimulation of the second messenger CAMP. So it is the stimulation of the second messenger. The second messenger CAMP. So what are included here? So what is included here? It includes the ACTH, CRH, then the TSH, the GHRH. Next it also includes the FSH, LH, the HCG. Then comes the vasopressin, and this includes the V2 receptor. Then there is also the catecholamines. Catecholamines, that is a B receptor. Then there is also the somatostatin, the glucagon, and then there is also the secretin, the parathyroid hormone. Next we'll look at the GI. So what is GI? GI is nothing but the inhibition, and this is the inhibition of the second messenger. This is the CAMP. And what does this include? This includes the catecholamines, that is the A2 receptor. Then there is also the acetylcholine. The acetylcholine is the M2, M4, and also the somatostatin. Next we move on to the GQ. So what is happening in the GQ? So under the GQ, it is nothing but the second messenger. Here the second messenger is a phospholipase C, is a phospholipase C or the cGMP. Phospholipase C or the cGMP. So what does it include? This includes, there's a phospholipase, there's phospholipase C. So phospholipase C is nothing but it includes the IP3 DAG pathway. So IP3 DAG pathway. and under this there is the GnRH, GHRH, the TRH, then the catecholamines, that is alpha 1 receptor, then comes the vasopressin, that is the V1 receptor, then comes the presence of gastrin. So this gastrin, there is cholecystokinin, gastrin, cholecystokinin, then there is also the oxytocin. Next, there is also presence of the acetylcholine. There is presence of the acetylcholine, and acetylcholine, it contains M1, M3 as well as the M5. Next you look at the cGMP. The cGMP, it includes the atrial natriuretic peptide. So atrial natriuretic peptide as well as the presence of the nitric oxide. Then we move on to the tyrosine kinase receptors. So we are writing is at TK in short. The tyrosine kinase receptors, this is through the JAK and STAT. So this is through the JAK and STAT, that is a non-receptor tyrosine kinase, or the MAP kinase, or it is known as a MAP kinase, and that is a receptor tyrosine kinase pathway. The receptor tyrosine kinase pathway. So what does this include? So it also includes the growth factors. There is presence of the growth factors. So growth factors, it includes the IGF, and there is also the VEGF, then comes the FGF and the PDGF. Then it also includes the growth hormone and the erythropoietin. Then there is also presence of the insulin and the prolactin. So some important concepts to know is that the cytoplasmic receptors are present in the cytoplasm, right? So we know the cytoplasmic receptors, they are present in the cytoplasm. But what we need to know is that in terms of the hormone receptor complex. So in terms of the hormone receptor complex, what is happening is it is formed and it moves to the nucleus. So it forms and it moves to the nucleus. So as it moves to the nucleus, it can carry out its actions. So this is important to note. And other thing is that the receptor of the tyrosine kinase have intrinsic. So the receptors, if you see the receptors of the tyrosine kinase, they have an intrinsic tyrosine kinase activity. So it is intrinsic tyrosine kinase activity, and they have an extrinsic internal tyrosine kinase activity and the non-receptor, whereas the non-receptor, the N receptor tyrosine kinase, they have an external tyrosine kinase component. External tyrosine kinase component, and this will interact with the receptor. So this will interact with the receptor.